Hello people, myself Dr.Shail Gupta. I am a dentist. Let's discuss about piarrhea, the stages of piarrhea, its treatment and its condition. All these things we will discuss today about piarrhea. Okay, so piarrhea is a condition which interferes in the gingiva, the gums, and it is seen like swollen or bleeding gingiva. So the gums or the gingiva sometimes have pus also. The infection is much and it takes the form of pus. The teeth are also mobile. Mobility of the tooth or teeth are seen due to the piarrhea. Piarrhea has three stages. In first stage, the bleeding gums we can see, and little bit swelling also is present. In the second stage of piarrhea, the bleeding gums is there, the gingiva is little much swollen, and the mobility we can see in the tooth like grade 1 mobility. And in the third stage of piarrhea, the bleeding gums is there, the foul odor, the foul smell comes from the mouth, and also the mobility of the tooth is there due to the gingival recession. So the mobility of the tooth is there like grade 2 mobility or sometimes grade 3 also. So these are the three stages of piarrhea. In all these three stages, the foul smell comes from the mouth, and in the third stage or even in the second stage also the foul smell, the halitosis is present. So and bleeding of the gums, and it is swollen. So these three are the main criteria and three stages of piarrhea which occurs. And why it occurs? Because it occurs because of the poor maintenance of the oral hygiene. So the oral hygiene is not maintained properly, so the piarrhea happens. And second is the due to pregnancy, that is due to pregnancy also some due to hormonal changes, and also the in absence of proper not keeping the hygiene of the mouth clean. So it happens. So during pregnancy also piarrhea is common. In women we can see the piarrhea commonly it happens. The main disadvantage of piarrhea is halitosis and the bleeding gums, and also the teeth starts shaking, the mobility of the teeth is present. So these all things happen in piarrhea. Now what is the treatment? See, if piarrhea is there, so we have to just go to the dentist as soon as possible. If we feel any blood coming from the gums while brushing, or any type of swelling issues, or any type of inflammation, or like a foul breath comes from the mouth. So all these things if we detect by ourselves only, so we have to just go to the dentist nearby, and we have to consult him or her. Accordingly he or she will the doctor will suggest you for the scaling process first, or the tooth cleaning, the supragingival and the subgingival, also the subgingival cleaning of the tooth, the scaling he or she will advise that we have to do. And second is the gingival irrigation, the gingival massage. And third is the ointments, specifically like Instacam, CNBC gum gel, Instacam paste, and gum tone. So these three are the main ointment, and the powder, this gum tone comes in the form of powder. These all things we have to do in piarrhea. We have to massage, we have to apply with our finger in the gingiva, and we have to massage twice or thrice a day. That doctors will prescribe accordingly to your condition. So yeah, and some antibiotics, some medicines may also be prescribed according to your condition. The doctor will prescribe. And mouth washes I recommend for the piarrhea, chlorhexidine mouthwash, or O fresh mouthwash, or accordingly doctor will prescribe you after visualizing and analysis of the condition. So yeah, piarrhea is very much it is one of the most commonly prevailing disease, especially in the women, and also in the children, also in the men, in adults. Piarrhea is most common, and in the first stage only, if it is treated, it can be cured, and less problems will be there. So these all things were today's discussion was about piarrhea. Please guys, take care and get treated about your condition as soon as possible. Okay, thank you.